This is the Horse Radio Network. Well, Glenn the Geek back with you and continuing coverage of the coronavirus as it pertains to the horse world. We've been doing these every night, almost every night, with the Facebook Lives, and this is another one of those. I have Dr. Gray with me from Colorado, and he is one of my longtime podcasting friends, and he is here to talk. We're going to dispel some myths tonight. That's what I want to do, because to be honest, Facebook is driving me insane, as I'm sure it is you. I've seen some of your comments. I know it is you as well. So first of all, of course, I am Glenn the Geek, founder of the Horse Radio Network. And we have a series of 15 shows on the network, just past 10,000 episodes. So while you're at home looking for something to do, if you listen to our entire back catalog, it will take you almost a year, 24 hours a day. So you can go catch up on all of those. And our app has become very popular. In the last week, we've had 500 people download the Horse Radio Network app. You can find that in your app store. Dr. Gray, introduce yourself.
Hello. Thanks, Glenn, for having me on. I hope that we aren't locked away in our houses for a whole year so that somebody could get through your whole back.
Yeah, me too.
Oh, man. So as you mentioned, I'm Dr. Gray. I go by Ryan. Right off the bat, I'm no longer a practicing physician, but I do have some interesting kind of experience with outbreaks based on my background being an Air Force flight surgeon, where I was stationed in Boston back in 2013, 14, 15-ish, was during the last really big Ebola outbreak. And so we were very prepared to take in patients, potentially have patients walking into our clinic, coming back from that. And I was the public health emergency officer. And with my role there in the Air Force, it was my job to basically have all of the protocols in place, whether it's Ebola, whether it's something like SARS-CoV-2 like we have now, or whatever it was my job to have all the protocols in place, know who's getting medication first, where all of our PPE is and how to put it on and all that fun stuff. And so it's been very interesting watching everything transpire with this current outbreak and what's going on in the world. So hopefully I can dispel some myths, as you mentioned.
And you are not the only doctor in the house, are you?
I am not. No, my wife is still a practicing physician. She's a neurologist. She's been able to take her practice kind of to the telehealth world. She mostly treats concussion, TBI stuff. So she's at home seeing patients through the computer like this. And so it's the four of us. I have two little ones, a 6-year-old and a 19-month-old. So we're planning on just being the four of us for a while.
So, Dr. Gray, I'm going to go through the list of myths here. And now I want to do a disclaimer, is that we are not giving medical advice in any way, shape, or form. This is for information only. Certainly, you can't trust anything I say in the medical advice department. But I wanted to give that disclaimer. So, obviously, listen to the CDC, listen to your doctor. We're just here to give our opinions on this whole topic, because that's all we've got.
You know what they say about opinions, right?
Yes, exactly.
We don't need to go any further.
So, this is the big one that I saw you post on, that I've been posting on. We've been posting on together, beating up some people about this one. And that is, this is no worse than the flu. What's the big deal? More people are dying with the flu every year than this. Why are we shutting down the world? And literally, this is the first time in history we're shutting down the world. It's the first time in history, Dr. Gray, that governments have agreed on something. So, I mean, think about it.
Yeah. Yeah. So, it's taken something pretty bad to get us all here. And look, I was in the same boat as a lot of people. A lot of physicians, a lot of healthcare workers have been in the same boat going, look, why are we so concerned about this? This was in China. This wasn't in our backyard. It doesn't sound that bad. Right. We as Americans have this thing with China. We don't believe anything they say anyway. So what are we concerned about? And I was in that boat as well. Oh, this is going to be no worse than the flu. It's just going to do its thing. But then it happened, right? Then it is in our backyard. And then we do see what is happening. The interesting thing is that a lot of people think that this is like some thing that we don't know anything about, right? Yes, it's a novel coronavirus. We have coronaviruses that are out in the wild and that cause 20 to 30% of kind of our normal head colds every year. But because this one's new, our bodies haven't seen it. It's not like it's worse than other coronaviruses. The thing that most people aren't really thinking about is that we don't have a vaccine for this. So every year what happens with the flu is we get the flu, it infects a lot of people do die, without a doubt. And hopefully we have less deaths from this than we do from a normal flu. But we can see from the data, not just guessing, but from the data in other countries, it ranges from South Korea, who's doing an amazing job kind of trapping this and controlling it at 0.6% death rate. So if I don't even know the math off the top of my head, 100 people get sick, 6% would be, I don't even know. Yeah. I can't do public math, Glenn. Don't make me do that.
Six people. So 0.6 would be like 1% of a person.
Yeah, 0.6 of a person.
Yeah.
And that's great, right? But then you think, well, the flu in this country at least is 0.1%. And so in South Korea, where by all intents and purposes, the world has gone, wow, you've done a really good job, we need to emulate that. It's 6 times deadlier than our annual flu here. In Italy, where resources have been overwhelmed, their death rate is closer to 7%, right? And that's 70 times potentially.
I mean, I saw a report, Dr. Gray, that Italy now is talking about if you're over 80, you're probably not going to get care. I mean,
yeah, and that's those are some reports. Some of the physicians over there have talked about they're posting on social media, so we can kind of see from the front lines. So that right off the bat, right, a lot of people are skeptical of our media, and I'm right there.
No kidding.
Our media blows everything out of proportion, and I've been telling this to people. Like, this is the boy who cried wolf. In real life, it's like, oh, it's the media. Oh, they're just sensationalizing. Oh, they just want their ad revenue. And now all of a sudden there is this really important thing and nobody is paying attention. And so, right, that's part of the problem. So go onto social media, read the accounts from the physicians on Twitter, on Instagram, wherever. And you can see right from the front lines that, right, there's an orthopedic surgeon there. They were saying the orthopedic surgeons in Italy are being handed the algorithm saying, here, go treat these COVID-19 patients. You're not fixing any bones today. That's the least of your concerns. Go take care of these respiratory issues. I hope you remember that from medical school. Right. And that's the biggest concern. And again, a lot of people have politicized this, and I'm not going to get into the politics. I think we can look at every outbreak in history and go, and our armchair quarterback it, or Monday, whatever they call that, and go, look, this was bad, this was good, this was horrible, we should be doing this, we should be doing that. It doesn't matter at this point. What I am concerned about is what each of you can do right now to potentially...
Before you get to that.
Yeah.
Why is it worse than the flu? Is it also because it spreads easier?
Yeah.
Yep.
So, and I was going to look it up. I forget. So we have the R naught value of how contagious something is. And I think the last time I looked, this one is right around like 1.5 or 2. So every person that gets it is going to spread it to 2 other people, or whatever that math is. And again, that's changing all the time as we get new data. The difference with the flu is that we have a vaccine. And so when one person gets the flu, it's harder to transmit because the people who that person is interacting with have a vaccine and they're not going to catch it.
They got the flu shot.
Hopefully, okay. Get your vaccines, get your flu shot every year. And so that's why this is spreading faster than the flu. And that's the biggest concern. Yes, it's deadlier than the flu. So again, we talked about the flu death rate being 0.1%. This, depending on what country you're looking at, anywhere from 0.6 to 7%, if not more in some places. So not only is it deadlier, but it's affecting more people because we don't have a vaccine, and it's contagious way before people know that they are sick. That's one of the biggest differences between this coronavirus outbreak and SARS that happened when I was in the hospital back in, I think, 2009, 2010. That was H1N1. I forget when the SARS outbreak was. I think it was 2013, maybe. Was that the people who were affected by the SARS virus, which again is another coronavirus, and they're calling this one SARS-CoV-2, is those people weren't contagious until they were already sick and in a hospital. And so very, very, very contained, very few deaths compared to what we're seeing now.
So with this one, you're exposed to it, you're contagious immediately?
No, well, we don't know because let me back up a little bit. Okay. So we have data from Germany. They had a known exposure at I believe an automobile factory, and the German CDC equivalent or whoever it was, the private investigators were out there and said, okay, we know you are sick. We caught this pretty early. Let's do a little investigation. I think they followed 9 people, and they were able to find from those people, as soon as they became symptomatic, they started testing them, and they tested them. And I think the doctor said that they had like 10,000 times the amount of virus in their throats compared to the SARS virus that we had a while ago. So super contagious. We don't know as soon as a person is exposed, right? We have a normal incubation period, it's called, from when somebody is exposed to when they're symptomatic. We don't know specifically here. We think it's like 4 to 7 to 9 to whatever days, right? It started off a lot bigger, and now it's getting smaller and smaller and smaller. Say, hey, 4 to 7 days, you're probably symptomatic, but you are contagious even before then. It's so. At the end of the day, everything is changing so fast, so we don't know. It stinks.
So, do you think, to get to kind of bottom line, and then we'll go on? Yeah. Do you think the steps that are being taken? Then I'll give my unknowledgeable opinion, just having read a ton. Do you think the steps we're taking now are warranted? I mean, closing things down and trying to get people to stop spreading the disease?
So, Glenn, let me ask you: has Las Vegas ever closed because CNN said,
no, "Oh, that's what I've been saying all along." Right? I think this should have been done 2 weeks ago. I think we're a little behind. You know, the only reason our numbers aren't higher, in my opinion, is we haven't been testing people. We haven't had tests out there.
We haven't had tests, so people need to go back and look. And again, this is not our administration sucks and they're doing.
No, and I don't want to go there. We don't do that here.
We don't need to go there, and I don't want to go there. And what we did was we declined using the tests that other countries were using, saying, hey, we're going to make our own. That failed big time. So we're playing catch up in the tests. Even as early as Saturday or Sunday, I was messaging with an emergency room physician, and she was doing telehealth just as extra work, telling people all day long, look, I'm sorry you're sick. We can't test you. We don't have any tests. This is here in Colorado.
Well, that'll keep the numbers down.
Our numbers are very, very, very low because we're not testing people.
Yeah, I mean, I think once we catch up to that, we're going to see this spike, and people are going to be shocked.
Yeah. It's not good. So your question is, do I think the actions are warranted? Yes, I think they need to be more. Right before we came on, there was another press conference, and the recommendations are less than 10 people. I'm in physician group specific for COVID-19, and they're like, that's ridiculous. Like, why aren't they just telling people to stay home?
Well, period? I got a question. Yeah, 50 people, so 20, so 2 of them in the room have it, and now we're spreading it to 48, and those 48 are now spreading it to hundreds. I don't get that. It's either yes or no, right?
Yeah.
I mean, I don't get that.
Yeah. Unfortunately, we as Americans, I think we have this, like, my individual rights are greater than everyone else's, which is why we have vaccine issues, which we have lots of other issues. And that is playing out here, is that our government, again, not a left or a right thing, but our government is scared, I think, to tell people, look, martial law, everyone stay in your house. That would cause a lot of panic. I think we're working towards that.
I do too. I think by middle of next week, the National Guards are going to be called up.
Sooner.
Yeah. So we did have some questions, and I want to talk again. I don't know how much time you have, but I'm going to keep talking to you. Tell me to stop. The vaccine. Now, they're testing vaccines on humans right now from various places, actually. And I know that's getting people hopeful, but we're not talking them being in the field by 2 weeks from now.
No, a year and a half more. Yeah, I was listening to it.
That's a long time to be locked in your house with your kids.
I was listening to a good vaccine expert talking about this, and he's like, "Look, I can make a vaccine tomorrow. The question is, will it work? Will it not cause you harm?
Well, what side effects? Yeah.
What side effects? And then one of the things that they see with some medications, with some vaccines, is that it seems to work, but then when you actually get the thing, your response is worse than if you didn't have the vaccine. And there's a special name for it. I forget what the name is. So we need to test, and we need to do lots of proper things. A lot of people are like, just drop the regulations and we can get a vaccine sooner. Like
but then that could turn around and kill 50,000 people.
You don't want to do that.
Yeah. So that answers that question. Now, one of the things, and a lot of our listeners have been saying this, and I've heard this over and over from my friends too, and especially one listener who works at Cirque du Soleil in Vegas. So it's been exposed here for the last couple of weeks. They get people from all over the world to come in. And she said a lot of her cast have been sick with the same symptoms in the last several weeks. Could it be that, and it just hasn't been tested, or they haven't been said, you have this?
Of course. Yeah, that's the question. How long has this been around? I was deadly sick, right? I got the man flu. As my wife likes to call it.
Your wife didn't give you any leeway, did she? Shut up and go to bed.
Back in mid-February, I was in London and I was in Paris at the beginning of January. This supposedly started in China somewhere in November, late November. Could I have been exposed then? Could we have been exposed then? Potentially, right? We didn't think about it, didn't know how to test it, didn't have any tests. So without a doubt, the question is, can we go back and look? And it's a great question. We don't have the bandwidth to do that now, and it's not important. If you're healthy, healed, that's fine. The question is, can you get infected again? And there's one case report out there that I've seen of a woman in Japan that supposedly was reinfected, but a lot of my physician friends are saying no, she was never cleared to begin with. She didn't have the mandatory 2 negative tests over 24 hours. So we'll see. It's yet to be determined.
So another question that we had, and this has come up in a number of places, and one of the listeners said, my employer announced that someone in one of our 3 buildings was confirmed to have it. The email didn't specify which building, but said that team members may have been exposed. She said, I saw my grandpa this weekend who is at a very high risk with COPD and stuff. How soon is too soon for him to get tested? You're basically not getting a test until you're showing symptoms at this point, right? So grandpa's got to get sick. Yeah.
Grandpa unfortunately has to get sick. There's not enough tests. There's not enough bandwidth from a provider hospital standpoint. And every hospital has, unfortunately, most of them are following CDC guidelines, and every hospital has their algorithm of, I need to make sure you don't have the flu. I need to make sure you don't have strep. I need to make sure you don't have XYZ. And then we'll test you for COVID-19 or SARS-CoV-2.
If they have the test.
If they have access to a test, yeah.
Okay, so the other one, and I'm interested in this one too. One of the listeners said that she has asthma, and is it true that if you have asthma, and I have asthma too, I do inhaler twice a day, and if I don't do it, I can't breathe. So, are we more susceptible to this one?
I don't know the answer to that. I saw a case report of like 200 patients in China, and they were trying to do some study, right? Number one, it's just way too early to know a lot.
It concerns me when China is related to study on people, by the way, but
you need to trust their doctors and their healthcare for this, or else we're SOL. So obviously age, we know, is a factor, although here in the US, a lot of younger people are getting sick. And so
some of them that are dying in their 40s and 50s.
Yeah. I have some hypotheses as to why.
Well, they're also saying high blood pressure, right?
Just being sick in general, right? Anyone who is sick, whether it's chronic
sick, really
not,
sick,
just your body is not primed to fight anything especially as severe as this is turning out to be. So whether you have asthma, high blood pressure, you have any sort of autoimmune
heart disease,
issues, heart disease, anything, right? And we're finding, I see one of the comments here about an anesthesiologist talking about cardiac cells. I've seen some reports about cardiac issues with this, neuroinvasive issues with this, where it's attacking the nervous system. I've seen GI issues with this. So they're finding that this virus, which a lot of people just think, oh, it's a lung issue, they're finding that it's attacking a lot of our body, which is why these healthier and younger people potentially are getting sick and dying.
So, I mean, we're obviously going to see the numbers rise in the United States as more tests are being done. Some people aren't getting tests and they're hanging out with other people, and that's going to happen here, as we know. And to be honest, if you live rural, I don't know, and the hospitals are going to be flooded. They're saying they're setting up drive-through. Well, they're setting up drive-throughs in cities and major areas. There's, most of this country is rural. This is a tough one. Other than staying home or forcing people to stay home, which they haven't been doing. That's why the bars are being closed, because they were packed last night in most cities. So
crazy.
Yeah.
It's so funny. I having grown up, right? You're in Florida. I grew up a lot of my life in Florida. Was in the Northeast.
Oh, we got spring break going on. They ain't going home.
Spring break, right? You see this post hurricane, right? On west coast of Florida. Oh, the hurricane missed us. Let's have a party. And yet they don't realize that 2 cities over, they got demolished and 100 people died. And it's a lot of the same kind of mentality that's going on here is, well, it's not me. It's not my family. I'm sorry your friends are dying, but I'm going to go out and eat like normal and live my life like normal.
If we take a look at your numbers, though, for Italy, and that at this point, Italy's the worst case scenario, although Spain and a couple of the other countries are going to catch up. France,
I just saw
too.
A comment from a nurse in Spain saying we are 3 days behind Italy right now. So just beware.
Well, so if that I lost my train of thought. So if we take those numbers, just to give somebody an idea, if you live in a neighborhood on your block, okay, there may be 30 houses in your block, right? And if there's 3 people on average in those houses, you're going to know somebody that's died. One of those people in those 3 houses could have died. If we take out, and I do think, some of these countries are saying 70-80% exposure. I mean, Germany and the United Kingdom, he just came out and said 80% exposure. That means everybody's going to know somebody that dies, right?
The UK, their attack of this is, let's not do anything and get everyone sick, right? It's the old school chickenpox parties. Yeah. Let's just have a big party. Everyone's going to get sick, right? The people who are going to die, sorry, you're going to die. And then we're just going to go on living our life. That seems to be the track that they're taking.
Except for the Queen. We're shipping her off to Windsor Castle and going to hide her in the vault. So,
But anyway, so Germany, I think they're saying 70%. Estimates here in this country are a little bit lower. But when you have 325 million people, even if half of them are exposed, you're dealing with 160 million people. If you look at the data that we do have, whether you're in France, Italy, China, wherever, and it's not a socialized medicine versus US medicine thing, right? We're not going to be better here just because of that.
No, once a hospital's swamped, it's swamped, right?
Exactly. Yeah. And so you have 160 million people. We know based on the data, about 20% of those people are going to need a hospitalization, and about 5 or 6% of those are going to need ICU level care. And we just don't have the beds for that.
We don't even have the oxygen tanks and everything else that's needed, do we?
We don't even have masks or gloves. Hospitals are running out of PPE now.
Well, and now we're starting to see in this country, too, emergency room doctors getting very sick. I mean, there's a couple of them that we saw reports on today. They're in critical condition. Yeah. And they're not old.
No. Young doctors getting sick. And even with the emergency declarations from Friday, Colorado, where I live, my medical license is expired, right? I'm a podcaster now and do other stuff. I teach at the medical school, but with the emergency declarations, I can go back to work if they need me.
Oh, is that right? They can call you up. Yeah.
Yeah.
So you can get called up back to the military in an emergency, or this. You're
I don't know at this point if I can get called back to the military, but I could walk to the emergency room across the street and go, "Hey, do you need me? I'm here."
Are you going to do that?
If they need me, potentially.
Good for you.
Yeah.
Well, thank you for that. Anyway, is there anything else you want to add here?
No, I think really the biggest take home is that the whole flattening the curve, when you look at why physicians are screaming from the rooftops to go out there, not go out there, right? It's just stay home. I'm sorry you're inconvenienced for a little while. Why we're shutting down Vegas, why Apple, Nike, Patagonia, all these companies are shutting down, is not necessarily to stop the spread. It's to slow it down so that we do have a fighting chance of saving those who are getting sick, so that our death rate can be as low as possible. That's the whole point of slowing the curve. Unfortunately, this is out in the wild. It's going to infect a lot of people. We just need a chance from a physician standpoint, from a hospital standpoint, from a healthcare system standpoint. We need a chance to be able to take care of everyone when they get sick, right? If you look at the flu, you have 60, 80, 100,000 people every year getting sick over the course of many months. And here we're looking at potentially hundreds of thousands of people getting sick and needing a hospital bed within a 2-week period.
2
right?
weeks,
within a month period, whatever it is, just exponentially faster. And that's the biggest concern. And that's why everyone is saying, look, schools are out. It's not a play date time. Don't go to the parks. That's what happened in Italy. Everyone went to the parks and kept spreading it there. The kids were going to hang out with the grandparents and killing their grandparents, right? Can you imagine from a kid growing up going, yeah, I visited grandma during the COVID-19 outbreak and grandma died. I think I gave it to her, right?
That brings up something. You keep bringing up things that I wrote this in my post this morning, in my morning post, is that, people keep saying, well, China got over this pretty quickly. Well, let's take a look at what China did. They shut down, but not only did they shut down, they were dragging, if they found out you were sick, they were dragging your ass off to God knows where. People were terrified to sneeze or they would get taken out. We're not doing that here.
No, South Korea, right? South Korea, they're walking around like we're walking around taking the census. They're walking around with thermometers going door to door going, are you sick? Are you not? We don't, and again, we're a very big country compared to other countries. We don't have the resources for that. And so we need the personal responsibility from everyone in the population to really follow the rules.
Why don't I have great confidence that people are going to follow the rules, Doc?
No, neither do I, right? Disney World is closing, and yesterday they're like, "Oh, we need to bum rush Disney because it's going to close.
Let's have a party." It was packed. I don't get it. And what's interesting too is, our podcasting friends, and some of them are the ones posting these things, and I'm going, I thought they were smarter than that, but I don't know.
Yeah, and that goes to show you, I've seen physicians with very similar kind of just not smart comments. Obviously, everyone deals with this in different ways, right, and with stress and fear and unknown. And I love Joe Rogan, right? And his biggest thing is that people need conspiracy theories because they just can't imagine that things just happen because.
Well, that's true. Yeah, that is true.
Everyone is trying to figure out, right? Did China make this? Wuhan is where the biolab is. Right? You can think that, but
it's probably some guy ate a snake, right?
Yeah.
It's that simple. Some guy ate a snake who ate a bat. Yeah. But that's too simple, right? Our minds don't want to accept that some guy ate a snake who ate a bat, and that's why we're here.
Yeah. And I don't want to be inconvenienced, so I'm still going to go to the restaurant. I'm still going to go to the bar. I'm still going to go to the gym. And so it's a top-down thing, and that's where the administration needs to really take charge. And hopefully we're getting there right today. They said no more than 10 people. As a recommendation,
that's still ridiculous.
Right? As a recommendation, they just need to go, you know what? This is serious. We don't want to be like Italy. We don't want to be like Spain's going to be in a few days. We're going to shut it down. I know it sucks. We're going to help everyone at some point when you need it, from monetary wise, whatever. Just stay home and let this pass is not the right word because it's not going to pass. But that brings up my final question. So I do believe we're going to see Trump
doing something by Thursday or Friday. He's gonna have to. The states are doing it now on their own. Actually, I don't think it's enough.
Something Friday. There were some rumblings, and we got some text messages that something was going to happen Friday. Unfortunately, it was just the emergency declaration.
Yeah.
There's rumors that something's going to happen tomorrow.
We'll see. I think
see.
something's going to happen, and we're going to see it snowball really quickly here. So that's the next, brings up the last thing, and the thing nobody wants to think about, nobody wants to talk about. Everybody's saying, and I'm seeing this posts everywhere, and this is hope. This is people just having hope. And we have to have hope, right? In a situation like this, we all have to have hope. But they're saying in a couple of weeks, this will be over, and we'll be back to back to square one. And I hope that's the case, but
yeah, the question is how long, whether that's a month or so or more. Like China's just spinning back up, but it's been a couple of months for them. CDC is saying 8 weeks is going to be kind of the minimum to get things done here.
If we stop spreading it.
If you just stop spreading it. Yeah, that's the problem. So look, I'm not a catastrophizer. The world's going to keep on spinning. We're going to have humans. We're not going to be annihilated by this. The question, though, for us in this country is how many people are going to die from it. That's the question. If we can just lock ourselves in our houses for a while and be inconvenienced for a little while and just take care of ourselves, then we will minimize as many deaths as possible. We will give our, just kind of another plug for our frontline people. We'll give our hospital employees, physicians, nurses, everyone a fighting chance to not only take care of the patients that are coming in whatever way they need to take care of those patients, but to take care of themselves too. If we overwhelm our hospital systems and we're out of personal protective equipment, and our hospital physicians and nurses are getting sick and they can't work,
that's the big concern, and God bless them all. It must be tough for them to go to work. I know I talked to a couple nurses who have plans to take their kids away, take their families away, and live by themselves once the cases start rolling in.
Yeah, it's time to go buy a little cabin up in North Dakota. I think they only have one case or something. So, yeah.
Well, Dr. Ryan, thank you so much for joining us. I really appreciate it. And it was good to talk to you again. I missed you at PodFest, but not under these circumstances. I wish we could have just had a drink together and had fun. But
yeah, hopefully sometime soon, once this is kind of calmed down a little bit and the world kind of picks back up where we left off.
All right.
Thanks, Matt.
All right, thanks. Hold on one second then. Thanks, everybody, for joining us. We really appreciate it, and we'll continue our coverage here. I do blog posts every morning on Horses in the Morning Facebook page and my own personal page for what they're worth. People seem to be wanting to read them and then regretting it after. But they're there every morning if you want them. Also, if you go to horsesinthemorning.com, click on the Corona banner. We have all of our coverage, all the videos we've done. We had a little fun Saturday night and played some equine trivia. So if you need a break, you can do that. Horses in the Morning, every morning we're staying off of this topic. We're trying to give you a break, give you some entertainment, and make it light and lively like it's been for 10 years. So Horses in the Morning is your reprieve. Just go listen to that, and Jamie and I will continue to be silly. So thanks, everybody, and we'll talk to you again soon.